If I had to write a newspaper headline to describe today's speaker, it would read something like this. Chicago hometown boy becomes distinguished physician, nationally renowned hospital administrator and health educator, yet never forgot from whence he came. Now I know that's a heck of a long headline, but our speaker, Dr. Terry Mason, is a heck of a person, uniquely knowledgeable about the public health cause and effect issues of violence. Please put your hands together and welcome Dr. Terry Mason.
Thank you so much, and I'll say it right this time, Judge Thomas. I've been promoted you to justice for a while, but so first of all, let me thank the organizers, all of the people who have participated, both as panelists. So today I want to spend just a bit of time, and some of what I am going to say has been covered already, and probably even been further discussed in each of the breakout sessions that you just went through. So just take the parts that you'll hear again as reinforcement, because I think that it shows that we're all singing from the same sheet of music. Now, I told you that deep down inside was probably a preacher, so I couldn't start this without a scriptural reference. And if I had to start out a scriptural reference to sort of encapsulate everything that we've been hearing about, what Michelle Alexander talks about in terms of mass incarceration and all of the things, it had to take me back to Exodus. And it takes me back to Exodus because it's about a people who have been enslaved, who were also subjugated to a laws that were not fair, and there was a plan and design. And so in this particular verse, it talks about coming up with the plan to deal wisely with them. These are the people of God that they were afraid that if they multiplied, in other words, that their birth rates began to increase, that they might join up with enemies of the state and come against them. And I'm not going to develop that, because I know if Pastor McCrae is still in the room, or any preachers. Any preachers in the room? All right. If there's some in the room, okay. Then y'all know that'll preach. So we're going to go forward, but I did want to set that as a sort of contextual framework to talk about what we're doing, because what has happened and what is happening with violence in the cities of Chicago and all across the country is not by mistake. It is not by mistake. It is a direct result of a number of policies, a number of which I won't have time to go in today, but we'll talk about them. So we talk a lot about gun violence. And if you look at the gun violence statistics, they actually have gone down. In fact, gone down over 20 years by half. And that's data that is easily available to study. The real gist of what I want to get to is that I have had a lot of time in my life where I've been in front of many people having what I call that discussions. And the big that discussion, if I have to have one more time, I probably will engage in projectile vomiting, is one over healthcare disparities. Because we've been talking about health, we have healthy people 2000, healthy people 2010, now we'll probably have healthy people 2020, and the people won't be healthy in 2030. And blacks and whites will still have all these disparities, and that's a whole nother discussion that I could get into. But the reason that I have projectile vomiting about it is because, and maybe I shouldn't have said that while eating lunch, but the reason I say that is because it is always a that discussion. It is that this group has this, and this group, it's descriptive, but it never gets to why. And so what we want to do is get to a why discussion, not a that discussion. Because many of you in your day jobs, you see the impact of the that's. You see all the young people that come before you, that have this problem, that have been arrested, that have had this happen to them, but we need to get with the why. So I decided that what we should do is do what we do in medicine. In the hospital, when we have an untoward event that may end in severe injury or death, or something that almost ends up in severe injury or death, we do what's called a root cause analysis. Anybody ever heard of that? We do a root cause analysis to try and figure out why it happens. And so there's many different ways to do a root cause analysis. There's a lot written on it, but the simple way to do a root cause analysis is ask the question why 5 times. So the first part is you have to define the issue. And the reason we like the root cause analysis is because where you have multiple factors, we put everybody in the room. We get the nurse, the clerk, everybody that was involved, even tangentially, with the care of this patient in the room. And we begin to say, okay, Mr. Jones or Mrs. Jones died. Now, why did Mrs. Jones die? And we want to do this in a way that, because with this particular way of looking at the problem, you begin to look at all the interrelationships. And that's what we need to do with this problem. And you don't need a bunch of statisticians. You don't need to look for a bunch of very sophisticated tools. This is a very simple way to do this. It especially helps when you have to deal with a lot of human factors. And you sometimes don't get the truth the first time around. So, because if you keep going, you eventually get to it. And you don't have to use, this isn't necessarily a big Six Sigma program, but we can do it. So, the first thing you have to do is write down the specific problem as best as you can to articulate. The key to this is articulating what you believe the problem to be. So you have to write it down. So I decided that maybe what we should do with this is write down the problem. And I wrote the problem is some black youth are killing each other. Because the media would have you to believe that it's almost all of us when you turn on the TV. So I put some. And maybe I should make few. Maybe I should say few, because it's really not that many. So the next thing is you ask, well, why is that happening? Why are some of our youth killing each other? So if that answer didn't get you to your root, you keep going, because you have to keep asking why that, and then why that. But the key to this process, and it will work with almost anything, is that you have to be brutally honest. Brutally honest. You can't sugarcoat anything. You can't say that maybe this or maybe that. No, you have to be able to face the facts straight on. And if one of these days I'll be able to take a case that we actually had that ended in a problem and actually take you through this process. The cases that I have right now are probably will be in front of some of you pretty soon. So let's go back, because a lot of the issues that we're facing with, though they may be in front of you today, they didn't start today. Some of these cases some of these problems started with children in utero. In utero. And so there's some data, and I'll show you the reference in just a moment, that understanding that the babies live in this mom, and the things that happen to the mom while the baby is being developed in various and sundry stages have impact on the baby. And not only the physical things, but the notion of feeling loved, the notion of feeling protected, the notion of feeling as valued are also things that get transmitted to this baby. And so when we have applied, not me personally, but when electric shocks, and I don't know why anybody would do that to a pregnant woman, but if the mother did receive an electric shock while she was ironing, the baby would sit straight up and would remain there for after almost 2 days, long after the insult was gone. We also know that what a mother eats, drugs and chemicals, not just the legal ones that we buy, not just the illegal ones, but the legal ones that we buy, alcohol, tobacco, but also some of the things that are in or not in the foods that we're eating today. Those substances can create problems that we have far, far reaching. For example, the March of Dimes has been very involved on a folate campaign. And the folate campaign is really, folic acid, is to make certain that the neural tube develops. So here's a vitamin that if it's missing, the neurologic system of the baby will not develop properly. So when we look at with the prenatal and perinatal area, that is just before the baby's born and just after, the whole notion of rejection and separation, we were just talking about this on the table, create other kinds of issues for this child. And that's why we have been, and will continue to be, a very staunch supporter of breastfeeding. Because breastfeeding is one of the most natural ways to establish attachment between a mother and the child. And where that's possible, and I know there are issues, but I'm very much a proponent of breastfeeding for not just that reason, but for some other reasons. So I'm gonna start with I'm gonna put up a little clip. There's 3 clips you're gonna see. 2 are from a movie, and 1 is from a young producer. And I'm gonna do this to sort of set some context for why we are where we are. So give me a minute here.
Has the right to know their ancestral history. Every person, no matter where they are in the world.
Most of the world history, 90% of world history is African history. And even that 10% African is extraordinarily involved in what it is.
You won't find a painting, you won't find a statue, you won't find a monument anywhere prior to 1500 that isn't African in some way, shape, or form.
For your information, that is from a DVD called Hidden Colors, a gentleman by the name of Tariq Rashid. This is a historian that put a lot of this together. This is the 2nd volume. So the question is, why am I doing that? Why am I showing you this? Well, let me just give you a little bit more here. So you think about a people who should have a very proud and storied history, and we're going to get into more of that in just a minute, because there's a lot in my mind that's one of, when we get to the root cause, that's what we're going to see where that gets developed. So how do we go from that sort of history to this? Has anybody seen any place that looks like this? Any stores that look like this? Or like this? You know what that says? That says L&M, and I hope they're not here, liquors, and it says beer, wine, medicine. You might say, but this isn't a pharmacy. Yes, it is. Yes, it is a pharmacy. Because what's happening is that these are central nervous system depressants. Alcohol is a drug. It's a legal drug, but it's a drug nonetheless. And this is a central nervous system depressant. And when people are feeling hopeless and people do not feel a way to be able to deal with their situation, they will turn to these agents. And these agents have what we call, there's a tolerance that's developed so that at some point, the more of it you drink, the more of it you need to drink in order to attain the same effect. So I'm going to do one other thing now. I'm going to take you down to, because I'm trying to develop the environment, because I'm trying to get to a root cause, or what I believe may be part of a root cause. So what we want to do now is I want to let you listen to a group of young girls. Many of you have probably seen this before, but this is a group of young girls that were captured on film, captured in 2005 by Kira Davis. And Kira Davis was a 16-year-old girl who decided that she needed to get this word out. In fact, she was featured on the Oprah show and a bunch of other places.
Every black female has a big butt, a big booty.
Loud, obnoxious. Yeah.
Light skin being more attractive than dark skin, but we're not smart.
We're disturbed that way, and a lot of times we have to prove ourselves as not being true.
At a young age, I already knew the standards for a girl like me. As I become older, they become more obvious.
You have to have perm hair, relaxed hair.
You know, straight hair or like blonde hair, you know, long waves or something.
And if it's natural, that's good hair. Like that hair is hair you have to relax because it's kinky.
Like it's not like a pale and a half, like natural hairstyles. Or like if they are natural, they have to be like the curly head, like black girl. Or something that looks mixed or something.
I remember when I first started wearing my hair natural, at first my mom was okay with it. And she thought it looked nice. And then after like the second day, she was like, oh, stop that. She was like, you're starting to look African. I was like, well, I am African. And that really pissed me off.
There are standards that are imposed upon us, like, you know, you're prettier if you're light skinned.
I knew people in the past that like just like wanted to be light skinned, not for any particular reason, you know, because they love themselves. I mean, they love themselves except for, you know, the color of their skin.
Like my siblings are all lighter than me, and my mom, she's dark skinned, but she's lighter than me. So like I noticed, and I'm like, hey, how come I'm the darkest, and you know everybody else is so light? And since I was younger, I also considered being lighter as a form of beauty, or you know, beautiful, more beautiful than being dark skinned. So I used to think of myself as being ugly because I was dark skinned.
I knew people who actually like went out there and got, you know, bleaching cream and everything. They actually like laid in the tub, like poured like capfuls of bleach into it just so they could like see if their skin would get lighter.
But yeah, my aunt that lives in Honduras, she basically started using skin bleaching cream when she was about 25. And she started her oldest daughter on it when she was about 11, and then she has an even younger daughter that was about 6 when she started using the skin bleaching cream on her.
I've seen people say that I would never marry a dark-skinned man because I don't want that in my gene pool.
On the other hand, like some girls have their issues too. We've been called high conceit and house nigga. I feel like both sides have their issues.
I guess I sort of felt like there was not any attention towards me because of maybe my skin color or because my hair was kinky or just really that. Or even when I was younger, like say there was I don't know, a doll. I used to have a lot of dolls, but most of them were just white dolls with long straight hair that I would comb, and I would be like, oh, I wish I was just like this Barbie doll. In Brown versus Board of Education, the famous case that desegregated schools in the 1950s, Dr. Kenneth Tharp conducted a doll test with black children. He asked them to choose between a black doll and a white doll. In most instances, the majority of the children preferred the white doll. I decided to reconduct this test as Dr. Clark did to see how we've progressed since then. Can you show me the doll that you like best or that you like to play with? That is the nice doll. And why is that the nice doll? He's white. And can you show me the doll that looks sad? Okay. Can you give
Why does that look bad?
Because she's black.
And why do you think that's a nice doll?
Because she's white.
And can you give me the doll that looks like you? 15 out of the 21 children preferred the white doll.
Did you see what she did when they asked which one were you? What did she do? She reached for which doll? The white doll. And then she had to stop, right? And then sort of readjust her reality to push forth the one that really did look like her. When we talked about, or when Marlita and other people this morning were talking about the adverse childhood experiences study, what you ought to know, and Marlita pointed out, and I'm going to reemphasize it, is that the adverse childhood experience study, the 17,000 patients in that study were a subset of 85,000 patients that were in a larger study that was being done about diet control. But the 17,000 patients that were there, 74% of those patients were white. Only 4% of the patients in that study were black. Only 4%. This has never been done in an African American population, this particular study. And if it were, the question would be, how would you design, if Waldo's in the room, how would you design a study to capture what you just saw? How do you factor in self-hatred? And how do you then determine what the impact of that is sociologically at a much larger level? Because I will submit to you that much of what we see carried out by our children is their number of factors, but at the core of it is still self-hatred. I can do this to you because I don't care about me. I don't love me. I don't value me. So why in the hell would I value you? Your life ain't worth nothing because my life ain't worth nothing. So I can take your life with reckless abandon because I don't feel that there's anything around in my surroundings that helps me understand and value who I am. Now, how does this, and you'll see how this all ties together in just a moment. So if we were to talk about the abuse that she talked about, or the household dysfunction, for some of the people that many of you see, judges, how many of them would you think would have a lot of this? Probably most of them. I actually did a subtest like this at last year's American Public Health Association in the African American section of the APHA. There was about 80 people in the room, almost, I would say 97% of them master's trained, and happened to give them the ACEs questionnaire. And to our surprise, most of the people had more than 3 positive responses to these questions. So the other thing that Marlita said, it is not a diagnostic tool, but it is something that's representative, even though if we were to redo this, we need to be able to factor the category that would help to get to the dysfunction cause. Because think about this. One of the number one things being sold in Uganda, Jamaica, and in other countries is skin bleaching cream. Skin bleaching cream. I know there was a group of women that were Nigerian, and they went home, very affluent people, and one is a very good friend of mine, and she came home and she told me that what happened was they were very excited. There were about 8 women sitting around the table, and they were very excited. She took out this big jar that she had just paid the equivalent of about $1,500 US for, and it was a very high concentration quinolone-based skin bleaching cream. There is a pathology, because I would submit to you the first day that white people decided to come up with some biochemical way to alter their skin to make it black, we would see a different sort of thing happening in America. So if these childhood experiences, and not counting for what I just told you, were to be factored in there, of course we probably see more depression. Of course we probably see, because if you think about more than sexual partners, do you know, and part of my job as public health is trying to do something about this, but Cook County is #1 in the United States of America in the number of cases of gonorrhea and chlamydia. #1 in the United States. Not a statistic I'm proud of. And we're going to be talking about what we're going to do. So I'm going to be proposing some rather radical things that may even end up in court, because I'm going to propose some very sweeping stuff. But what happens is that what else is in that CDC monogram is showing the dysfunction that happens in the temporal lobes between a healthy brain and an abused brain. And I would say that this is for anybody. Marlita showed you this morning, so I'm not going to go back over it again. But there's always a but. Dr. David Satcher, my mentor and one of the former Surgeon Generals and Secretaries of Health and Human Services, he and Carl Bell have worked a lot, and he always says risk factors are not always predictive factors because of protective factors. And the protective factors, in my humble opinion, are what we're seeing eroding in our communities. Because we've always had the issue of self-hate. There's been nothing in the black experience that helps to affirm the black experience, even in the black church. Because the images that were projected in the black church were not images that supported the efficacy of black people. Because if I didn't see, nowhere, everything I saw on TV didn't look like me, everything I read in the books didn't look like me, and when I go to church, nothing looks like me, then who the hell am I? Where's my value? Doesn't God love me too? So don't get me started. But anyway, but this is real. And this is a thing that we don't want to get to. We don't want to talk about it, and black folks don't even want to talk about it because it's painful. It's painful, but it's true. So those protective factors that we talked about, the village construct, because if there was something going on in your house, if something wasn't going right in your house, you also had this whole village protecting. I remember I grew up in Inglewood, and there was a lady that sit at the top of her 2-flat back porch, and she'd see us playing in the alley, and she'd holler, "Son!" That was the name for all the boys, son. But for some reason, you knew when she was calling you. And you also knew that you better stop what you were doing, come out of the alley, go up those 4 flights of steps to see exactly what she wanted. Even if it was for you to go to the grocery store, put the change in the bag and come on back and give it to her and then go back, and you didn't say a cross word about it. And if she thought you did something that wasn't right, she told your mother. I see in the heads nodding, you know where that goes. That's the village, that's social fabric. Also, when people got laid off and couldn't pay their rent or couldn't pay their house note, we had quarter parties to help. I mean, we worked together as a family unit. And of course, the one thing that I have to say here, and one of the things that we're going to have to write about, is what was the price we paid for integration? What was the price we paid for integration? That's another topic. So why are some of our children perceived to be so violent? And is that the reason for the increased incarceration? I don't think our children are violent. I think they're hurt, and I think they're angry, and I think they feel unprotected, and I think that they feel that we've abandoned them. Now, some of them just bad as hell. So I'm not going to dismiss that. But if you look back, even at the ones that are like that, if you look carefully back in their history and where they came from, what they came out of, going all the way back to the time that their mothers conceived them in the womb, if it wasn't contaminated with all kinds of agents. So is that the reason why we have so many more incarcerations? The question is, what are we modeling as adults for our children? What are we modeling? Because that's what they're going to learn. First from us, and then especially those in the church. There's some of our churches that don't want some of our kids to even go to those churches. It's not a welcome environment. I'm not, I ain't trying to say nothing here, but I'm just trying to say something. And the question becomes, what are the things that we can do in our church and society? Because you can't put it on the church. The church ain't the mental laundromat. It may have some detergent to help us with our mental illness, but it is not the be-all and end-all, and it is not the way it should be. It should be if our children are valuable members of society. And sometimes I don't believe that it's perceived in the things that we do that they are, particularly when I look at the way that we're incarcerating our children. So I'm going to stop and go back to the last part of my little video clip.
The 13th Amendment reads, slavery is abolished except when you are found guilty of a crime and go to jail. So prison is the slave plantation. And look at all the things that are denied you in jail is the same thing that were denied Africans on the plantation. Slavery still is very much alive.
Today, there are more African American adults under correctional control in prison or jail on probation or parole than were enslaved in 1850, a decade before the Civil War began. Crime and crime rates did not drive mass incarceration to begin with. Incarceration rates have fluctuated over the years, gone up, gone down. Today, are actually at historical lows, but incarceration rates, especially black incarceration rates, have consistently soared regardless of whether crime is going up or going down in any given community or the nation as a whole. War on drugs, which has been a major engine of mass incarceration, has targeted poor communities of color, especially black and brown men, even though studies have consistently shown now for decades that people of color are no more likely to use or sell illegal drugs than white.
Before 1964, the prison rate in America, the majority of people in prison were white people, were white guys. But the thing is, there was no need to have a strong police presence in the black community because black people were already controlled by the basic laws of the land. Black people were already controlled by Jim Crow laws, signs saying black people drink from this water fountain, black people could live in this neighborhood. So black people were just controlled, period, at that time. Now, after the Civil Rights Bill passed in 1964, this is when the police presence became very strong in the black community because the average citizen couldn't control black people like they could before then. So they came up with another strategy and had law enforcement do it. So around 1964-65, black communities were flooded with law enforcement, and this is why the Black Panthers were started, because of the police brutality that had started in the black community.
Prisoners themselves represent a small percentage of the population under correctional control. Like today, there's about 7.6 million people under correctional control, but only about 1.3 million are in prison of them. The rest are on probation, parole, and jail overwhelmingly for minor, non-violent offenses and drug offenses. The problem is that even if you don't get prison time, even if you're lucky enough to get just felony probation, you're saddled for the rest of your life with a felony record. And so the question is, in my view, just who's in prison? The question is, who is branded a criminal or felon and must live with that label for the rest of their lives?
The people said, well, if we don't need black labor, what do we do with it? Well, we have to set up a system in the commercial system, or at least incorporate black people into the commercial system so that they make us money. without having to do the labor of picking cotton or picking sugar cane or whatever. We're already past that. So how do we make a more sophisticated plantation where we can keep slaves? Well, let's criminalize pretty much every damn thing that we do. There are over 1 million laws on the books now. Who needs 1 million laws? Unless you want to control people's behavior.
The police presence has always been in the black community because we are prisoners of war. That's number one. The original police were created to catch slaves. They were slave catchers. There was no need to police a white society. There was no need for that in early America. There was no need for that. Police even became wild when police were always about guarding property. That's what the police are about, guarding property. See? Their job gets stretched out to a moral responsibility and public safety and that kind of thing later on in their development. But the original concept of a police officer is to make sure your property stays with you. They are hired by the rich, first of all, to protect the richest property.
People of all races who are jobless, especially chronically jobless, are more likely to be violent than those who are not. And ghettoized communities are areas of concentrated poverty and joblessness. So it's not a surprise that there are higher rates of violent crime. And this idea that there's something especially wrong with black men that makes them more likely to be violent, or especially wrong with black culture, that leads to high rates of violence is just disproved by all of the available evidence. If we were to invest in education and job creation in the communities that needed it most and eradicate these high levels of joblessness, we would also see the racial disparity in violent crime disappear.
A lot of people don't know the original street gangs in America were European immigrants, and the movie Gangs of New York goes into that, how these Europeans came over and they formed the first street gangs in America. And the thing is, they weren't demonized.
There was a wave of white crime, where white immigrants coming to the United States who were jobless and poor were engaging in high rates of crime. But the response wasn't, let's lock them all up and throw away the key. The response was, what can we do to save our young men? And they went in and invested in education and job creation and providing social services and a safety net to ensure that these young men did not slip through the cracks, and viewed them as one of us who need to be protected and saved, whereas young black men in ghettoized communities are viewed today as largely disposable.
If you want to see the rest of that, there's a whole, and again, I use this as a provocative thing. You take from it what you wish, but we have to stimulate a different kind of conversation. Otherwise, 20 years from now, we'll be sitting around talking about violence, just like we talked about it today. And that's the thing I don't want to see happen. That we have got to come up and be honest, brutally honest, with the answers that we find, and accept the fact that all of us, every single person here, and every single person that you touch, and every single structure that we can modify, every single law that we could change, every single thing that would help create a better environment for all of our children. Because none of our children are safe if all of our children aren't safe. So I thank you for your time and your attention.